Phoenix VA Hospital, 2019. Dr. Sarah Martinez had been working there for 6 months. She was 34 years old, Stanford Medical School, top of her class. She'd chosen the VA because she wanted to help veterans, to give back, to make a difference. But 6 months in, she was drowning. The VA system was overwhelmed. Too many patients, not enough resources, veterans waiting months for appointments, some dying before they could be seen. Every night, Dr. Martinez stayed late, reviewing cases, writing notes, trying to save lives on paper when she couldn't save them in person. And every night, around 9 p.m., the janitor came to clean her office. Older man, maybe early 60s, quiet, polite. He'd knock softly, empty her trash, mop the floor, and leave. She barely noticed him. Just another face in the building, just the cleaning guy. His name was Robert Harrison, but everyone called him Rob. Sarah didn't know anything about him, didn't ask, didn't have time. She had veterans to save. Tuesday night, late October, Dr. Martinez sat in her office. 10:30 p.m., still there. But she wasn't working, she was crying. Earlier that day, she'd lost a patient. Tyler, 23 years old, Iraq veteran, 2 tours, came home with PTSD, nightmares, flashbacks, the whole textbook. She'd been treating him for 4 months. Therapy, medication, support groups, everything by the book. That morning, his mother called. Tyler had killed himself, gunshot, in his apartment, alone. Dr. Martinez had done everything right, followed every protocol, every guideline, and Tyler was still dead. She sat at her desk, head in her hands, sobbing, thinking, I failed him. I'm supposed to save them, and I failed. There was a soft knock on the door. The janitor. Rob. Doctor? You okay? She wiped her face quickly. I'm fine, just rough day. You can clean. I'll get out of your way. But Rob didn't start cleaning. He stood there, quiet. Then he pulled up a chair, sat down. Want to talk about it? Sarah looked at him surprised. I can't. Patient confidentiality. Don't need names, just, you look like you're carrying something heavy. Sometimes it helps to put it down. She hesitated. Then, I lost a patient today. Young veteran. PTSD. He took his own life. I tried everything. I did everything right. And he's still gone. Rob nodded slowly. How old? 23? Iraq or Afghanistan? Iraq. Rob was quiet for a moment. Then he said something that made her look up. You didn't fail him, Doc. The system failed him. You tried. That matters more than you know. Sarah stared at him. How would you know? Rob didn't answer right away. He just rolled up his left sleeve. There was a tattoo. Faded. Military insignia. 3rd Battalion. 75th Ranger Regiment. Sarah's eyes widened. You're a veteran? Was. 28 years Army. 6 tours. Fallujah. Kandahar. Baghdad. Ramadi. Came home in 2014. She couldn't believe it. Why are you working as a janitor? You could work with us, therapy, peer counseling. You have the experience. Rob smiled, sad smile. I did, Doc. 8 years. Right here at this VA PTSD counselor, veteran support groups, suicide prevention hotline. What happened? Burnout. I couldn't save them all, just like you today. Lost count of how many funerals I went to. Brothers I tried to help. Couldn't. They still chose the other way out. He paused. One day, I broke. Just like you're breaking right now. And I couldn't do it anymore. So I quit. Took this job instead. Sarah looked confused. But why cleaning? You're throwing away your skills. Your training. Rob shook his head. Am I? He leaned forward. Doc, veterans come here broken, ashamed, angry. They see you, white coat, stethoscope, authority figure. They don't open up. They say what they think you want to hear. Then they leave, still broken. But me? He smiled. I'm just the janitor, invisible, nobody important. So they talk to me, waiting rooms, hallways, parking lots, smoke breaks. They say things they'd never tell a doctor. Sarah whispered, like what? Like I'm thinking about ending it. Like I can't take this anymore. Like, nobody understands. And I say, brother, I've been there. I get it. And I'm still here. That means you can be too. He pulled out his phone, showed her his lock screen. Photo of 14 soldiers in combat gear. Smiling, dusty, young. My Ranger platoon. Fallujah, 2007. Out of these 14 men, 6 died in combat. That's war. I accepted that. He swiped. Another photo. Funeral. Flag-draped coffin. But 8 more died after coming home. Suicide. Every single one. That's not war. That's failure. System failure. And I won't accept that. Sarah's eyes filled with tears again. How many have you helped? Rob shrugged. Don't keep count, but I'm here every day. And some days, a veteran stops me. Says, Rob, I was gonna do it, but you listened. You saved my life. That's enough. That's why I'm here. The next morning, Dr. Martinez did something she'd never done before. She pulled Rob's employee file. Robert Doc Harrison, age 62. Purple Heart, Bronze Star with Valor Device. Army Commendation Medal. Combat Medical Badge. Decorated Combat Medic. 28 years service. Medically retired, 2014. Worked as PTSD counselor, 2014 to 2022. Resigned voluntarily. Hired as custodial staff, 2022. But then she found something else. Patient recovery notes. Over the past 2 years, 12 different veterans had mentioned the janitor in their treatment progress. The janitor listened when nobody else did. Rob saved my life. Literally. That old guy who cleans, he's the only one who gets it. 3 veterans specifically credited Rob with preventing their suicide. Sarah found him that afternoon, cleaning the hallways. Rob, I looked you up. I had no idea. Purple Heart, combat medic. 12 veterans credit you with saving their lives. Rob kept mopping. That's not why I do it, Doc. I know, but why didn't you tell me? Tell anyone? He stopped, looked at her. Because heroes don't need recognition, Doc. They need purpose. I found mine. He started mopping again. Besides, the moment I'm official, I stop being invisible. And invisible is where I do the most good. Dr. Martinez watched him work. This man, decorated veteran, trained counselor, choosing to clean floors because that's where he could save the most lives. She realized something. She'd been so focused on protocols, medications, therapy sessions, all the official ways to help. But sometimes the most powerful medicine is just, I've been there. I understand. You're not alone. Today, 3 years later, Rob Harrison is still at Phoenix VA Hospital. He's officially listed as Peer Support Specialist. But he still cleans at night. Old habits, he says. Veterans seek him out now. They know. Word spread. The janitor who gets it. Dr. Martinez works with him now. She learned something from Rob that medical school never taught her. Sometimes the most powerful healer isn't the one with the degree. It's the one who's walked the same road. Rob was asked once, "Why do you still do this? You could retire. Rest." He smiled. "I lost 14 brothers in combat. I lost 8 more to suicide at home. That's 22 men. 22 reasons I wake up every day and come here. If I can save even one veteran from becoming number 23, that's enough." 22 veterans die by suicide every day in America. If you're struggling, call the Veterans Crisis Line. 988, press 1. You are not alone. Brothers and sisters are waiting to help, including the ones you'd never expect, like the janitor.